The presence of a comprehensive stroke center in Montgomery County, CHI St. Luke's Health, is extremely important, not only to Montgomery County, but all the surrounding adjacent counties, including Walker and Grimes and Waller, San Jacinto and Liberty. As you become a comprehensive stroke center, depending upon whether the patient's going to be transferred by air or by land, that distance will increase. And with Houston becoming the third largest city in the United States and traffic being often a problem, the EMS are often, at the time, struggling with where is the best place for that patient to go. CHI St. Luke's Health offers a viable alternative for patients in all these surrounding counties to go where before they would have to go to the medical center.
The Woodlands Hospital became a primary stroke center in 2010, and as we looked at becoming a comprehensive stroke center, we had our survey in 2014. We really focused on working with EMS to provide better care to the patients that they were transporting to us. And so we worked together with MCHD to really streamline our process. When they call a stroke alert, we're ready in the emergency room for them to bring the patient in. And we really rely on their assessment skills out in the field to identify patients that might be an acute stroke.
We're very fortunate here in Montgomery County to have the partnership that we have with CHI St. Luke's Health, the Woodlands, especially with their comprehensive stroke center designation. For many years we had hospitals in the county that had stroke care, but none of them were a comprehensive level of service. And so not only did it really help us here, it's also helped us across the entire county, because the focus and the attention that St. Luke's has brought to stroke in this county has really affected beyond just the Woodlands area.
Patients that are living in areas where there's not stroke care available, we can now bring those patients into our comprehensive stroke center. And we really rely on the first responders' skills in the field, that they can identify an acute stroke and transport them to the best place possible for us to provide the care.
A DNV certification for a comprehensive stroke center is important to patients because it encompasses the entire spectrum of stroke care, including evaluation, treatment, rehabilitation, and education. The neuroscience team here at CHI St. Luke's The Woodlands is as comprehensive as the stroke service itself. From outside looking in, often people think of just doctors and nurses, but we'd like to point out here there's no I in neurosurgery, neurology, neuroradiology, or neuroendovascular. The team is made up of many different individuals, including a very supportive administration, nurses that cover all spectrum of stroke care. As well, there's pharmacists, there's physical therapists, occupational therapists, physician's assistants. There's a dedicated neurology and neurointensive team, a dedicated neuroradiology team, as well as specialists in neuroendovascular. And then there is a comprehensive neurosurgical program that supports all these services.
Our stroke patients here at CHI St. Luke's The Woodlands Hospitals comprise a large quantity of our ICU census. We take care of a great deal of neurosurgical, neuroscience-related patients, many of which have acute strokes. It is a big part of what we do every day.
We have a support group for stroke patients and their families so that they can go and discuss with one another the challenges that they've been facing and also the solutions that they have found.
One of the most rewarding things that I've ever done in my career is to start a stroke support group for stroke survivors and for stroke caregivers. A lot of times, especially when the caregiver goes back to work and the survivor's left alone at home, they feel like they're isolated, and they don't feel like the challenges that they have, they don't realize that those are challenges that every stroke survivor has. So it's a really good way for them to all interact and get together and discuss their challenges and realize that they're all facing very similar issues.
Patient care and quality here at CHI St. Luke's Health is extremely important to me as the director of the ICU, but I think it's important to everybody who's a part of this team. We started over a dozen years ago with a small community hospital, and it's expanded to include a very comprehensive cardiovascular and neurosurgical program. What's impressive about this facility is, unlike other campuses that can also provide excellent care, the doctors and every member of the staff, from the physicians all the way down, lives, plays, works, and breathes in this community. And I think that adds a layer that you just can't replicate anywhere else. The people we will see, the patients that we will encounter are often our neighbors, our friends, our relatives. And it creates an environment where caring is truly a part of what we do every day. I think that permeates to where when patients come in with a stroke or other conditions, even if they're not a relative, we feel like everyone's job is to treat them as if they're family.
Knowing the signs and symptoms of a stroke can save lives. Click here to learn life-saving tips from our neuroscience team at CHI St. Luke's Health, the Woodlands Hospital.